The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
I've been a nurse for the last 17 years now. I'm a global nurse because I've started as a nurse in the Philippines and then moved to the UAE, and then now I'm based in the United States. And with what I do right now, I work for a staffing company, but I oversee their education and development arm. So I have a team of educators in the Philippines, and our main focus really is to help our Filipino nurses who are migrating to the US to provide them with our international transition to practice program. And how this is different is that most of the hospitals here or healthcare systems here in the US usually do their transition to practice while the nurses have arrived in the States. So for us, we are trying to maximize their waiting time, because for many of us who are transitioning to the US, it's usually you wait for a long time for your visa. So we wanted to maximize that waiting time and utilize the time to train our nurses, provide them with opportunities to practice US-based practice settings, so that when they come here, they don't have that culture shock portion. And like, we also not just train them clinically, but we also provide them with a cultural and community focused training so that they're really set up. Like, we provide sort of like a holistic preparation for them as they come here.
Good morning, Dr. Arnold Tariga. Thank you so much for agreeing to be one of my highly esteemed guests today for my podcast. And I would like to also tell you how I am very thankful of your advocacy, and also your credentials speaks volume of yourself. And I would like to also congratulate you for a very successful Global Nursing Award event that you attended. I'm so proud to be one of your colleagues, and also part of your mission is to be a transformational nurse educator, which I think you are bringing that so much to our fellow kababayans. So welcome to my podcast.
Of course. Firstly, thank you so much, Dr. Peter, for having me. I'm always very grateful and excited to team up with amazing nurses and nurse leaders like yourself, especially when we talk about different initiatives for not just for our nurses here in the US, but even for our Filipino nurses or other internationally educated nurses who are thinking or are planning or in the process of migrating to the US. I feel like I'm just so blessed to be able to have an amazing network of nurses here in the US. You know, being new to the US, there has just been like a lot of great people that I've met and have been very supportive with my journey. And like, now I'm also grateful that I have this opportunity to pay it forward to our, the next generation of Filipino nurses coming here.
Thank you, Dr. Arnold. I was an international educator nurse as too. I was born and raised in the Philippines, but when I moved here, I studied also LBN and then moved back
Oh,
again to
wow.
University of Luzon. And due to my visa processing, so I was moving back and forth, and I can see and connect with our fellow kababayans too. And this initiative of yours to drive excellence in nursing education and also train our internationally educated nurses is a great initiative. So I really, really applaud you for this initiative that you're doing. And I'm so proud of you. Our listeners and also our followers would like to ask, what are the most common emotional or psychological challenges internationally educated nurses experience during their transition into the US healthcare system?
So if there's one thing that I know, both from the research that I've read and from living this experience, because as I've said, I moved from the Philippines to the UAE and now in the US. One of the most commonly experienced challenges from an emotional and psychological perspective is the profound loss of identity. And by that, like, I mean, like, most of the time, a lot of our international nurses actually are very experienced nurses. For example, myself, I came in here in the US, having worked in the Philippines and in the UAE with a cumulative experience of around 12, 13 years of experience. And then I've also moved in different areas. But then when you come here, the usual entry for our Filipino nurses here are usually the bedside. So sometimes you get confused as to, and again, like for example, in the Middle East, before I transitioned here, I was already working as a clinical nurse educator. But then going back to the bedside nursing, sometimes you get confused as to what am I really doing as a nurse? Because like it's like you're going back to zero again. And that's why like sometimes you get confused. And with that also comes imposter syndrome. You feel like, oh my God, like I'm the newbie again in the clinical area. Even if you've had those like, let's say 10, 15, 20 years of experience, but because you are now a newcomer in a new system, you feel like you do not know anything. And in a way, like that's also true because there are a lot of nuances in terms of the practice settings, right? Like in the Philippines, for example, and in the Middle East, like we still did not use a lot of electronic medical recording systems. So upon coming here, Epic or Cerner was very new to me, and I didn't know like how can I navigate these different tabs? You know, how can I make sure that I properly document? So there was definitely like that loss of identity and imposter syndrome. Another thing would be definitely homesickness. Sometimes it's so difficult to be living away from your family, and a lot of our nurses usually have their families. Like in a way, I'm lucky, I guess, because like I'm single, and I've always I guess like I've always been used to being on my own most of the time. But I still felt a little bit homesick just because like when I was in the Middle East, I lived there for almost 10 years. So I was able to already create or like I have been a part of a Filipino community there. And not just even Filipino communities, other international nurses who have lived and worked in the UAE too. So I felt like, I left a big chunk of my family when I left the UAE. There's definitely that fear of making mistakes as well, because again, it's a new community, the pressure that you have to prove your competence because you always claim that, yeah, I've been a nurse for 10, 15 years, I've worked abroad, so therefore I have to be competent. But then again, because there are things that you might not know, then sometimes that will stress you out emotionally and psychologically because you have to have that front that I'm okay. And some of it as well is the fear of like, if I will be viewed as someone who's not competent, I might lose my job, especially for those who are coming here for with a working visa, right? So they might think that, oh my God, maybe they will discontinue my working visa if they think that I don't know what to do. So those are just a few that I personally can say that I have experienced, and many of our internationally educated nurses have experienced when we talk about emotional and psychological challenges as an IEN.
I can definitely relate with what you have mentioned, and a lot of our kababayans flying from the Philippines going to the US is they kind of face those emotional and psychological challenges, which I think this your program and with your help they can definitely offset those barriers. How does your cultural adjustment or culture shock impact clinical performance or academic success for our internationally educated nurses?
From my perspective, I think the way it impacts nurses is through how it affects their ability to communicate and make clinical decisions and even advocate for their patients. Because, for example, I think one of the cultural nuances that I personally have experienced and many nurses would have experienced coming from the Philippines and from the Middle East is this culture of hierarchy in healthcare, right? So, like here in the United States, and I guess like a lot of the Western healthcare systems, nurses like ourselves are empowered to actually speak up, advocate, be more assertive, and if needed, you are even allowed to challenge decisions made by your other team members, right? As long as it's like geared towards making sure that your patients are safe. But in the Philippines, most of the time, we usually just say yes because we don't want to have retaliation. We're scared to question physicians and stuff like that. But so coming in here, because I was not accustomed to it, I was not accustomed to speaking up. Sometimes, like, I'm not so sure if should I communicate if I find something that I feel like I'm not comfortable with, or like, will I be retaliated if I speak up against a physician who I think was not making the right decision for my patient. So and because of that, like sometimes again, it sort of hinders my ability as a nurse to communicate and at the same time to critically think, because that it's like should I be thinking about this, or should I just wait for the physician to make that decision? And that's the reason why it's very important for us to make sure that our nurses who are coming here in the United States will be made aware that there's not that culture is non-existent here in the US. In the US, you're allowed to speak up, you're allowed to question. Of course, like in a manner that is also professional, right? Like you shouldn't just be shouting at physicians or other team members when you're raising concerns or questions. But it's very important to know that you will not be retaliated if you ask or if you challenge an intervention, for example, because like it's okay. That's a culture here. And at the end of the day, our focus really is to make sure that our patients and ourselves as nurses who are licensed to practice are safe.
That is well answered, Dr. Toriga. And when we say culture shock, some of our Filipinos are very passive and could be hesitant at first. But once they get the routine of speaking up and being a patient advocate, and also their communication skills improve over time, and that's wherein they really perform best at the bedside. Okay.
I agree. And just to share, Dr. Peter, like even for me, like I've worked in the Middle East for quite some time. I'm used to communicating with some colleagues different from different nationalities and countries. When I was new here in the New England area, because I'm currently based in Boston, it was so challenging for me because there were some terms in terms of communications that I was not so used to. Like there was one time that one of my patients was asking about a Johnny. I didn't know what a Johnny was. I'm not so sure if you know if you use Johnny there in the West Coast. So it so happened that I work with a workmate named John, and so I went to John. I was like, John, my colleague, my patient is looking for you, and then he said like, why is your patient looking for me? Like you're your patient's nurse. And so I brought John with me, and then I found out that Johnny is a patient's gown. So my patient was looking for a patient's gown, not my workmate Johnny. So these were some of the things that initially I was like, like this might sound simple and funny, but like in real life, when you're a nurse there, like it would really help if there are opportunities for you to learn these nuances, or like this, what are the layman's terms that your healthcare system or that healthcare community is using, so that you will be able to communicate with your patient well.
That's great. Thank you so much. And I also learned something here today. We don't actually use that here in
Johnny.
California. So I will definitely put that in my memory to remember that
Yeah.
patient asks those terminology. We have to be very aware of that one.
Right.
As a transformative nurse educator, how do we play in promoting the mental well-being of the internationally educated students or mentees that you have right now?
As educators, we must understand that we are not just educators. What we have to think is that we are lifelines during one of the most vulnerable professional transitions of our nurses, right? Because, again, like sometimes we think that our role, especially when you are facilitating the transition, is to just provide resources, to provide reading materials or videos that they can access. But there's more to that, because basically the Filipinos, for example, the internationally educated nurses coming from their home countries who are coming here, doesn't have anyone that they can trust, that they can go to as a resource. So it is important for us to be very intentional in making sure that we build trust, we ensure that they feel safe, that they feel that they belong. So having those feeling of safety and belonging, so that they feel seen and valued, not only for what they do, but for who they are as people and as nurses in their new communities and in their new hospital systems. And it's also very important for us to really normalize conversations about stress, anxiety, and culture shock, because these are feelings and emotions that they will definitely experience as they come here. And we need to make sure as well that they are equipped with emotional resilience skills, and not just clinical ones. Because as I said, like from my personal experience, most of the time, hospital systems just focus on making sure that, these nurses are clinically competent, that they're able to perform bedside routines, that they're able to use equipment. But what they sometimes forget, and maybe they just don't know, that all of these nurses are moving their lives here in the US. And when they move their lives here in the US, they're not just here to work. They plan to stay here and to plant their roots here. So if you are moving into a new community, it will be so difficult for you if you are not settled, if you are not prepared. So it's important for nurse educators to advocate, especially for us. If we already know that this is the system, this is how they're going to be able to thrive in the community and their new healthcare systems, we have to advocate for them. We have to make sure that we speak with our leaders, for example, in our healthcare systems, or community leaders. So, for example, I believe both of us are members of the Philippine Nurses Association of America and our respective chapters. So one of the things that I usually do if I know that nurses are going, for example, to Washington State with our hospital partners, is that I connect with the PNA Oregon Washington chapter so that we will have a group of Filipino nurses who will be able to welcome these new nurses. I also made sure that I communicate with the NPD team of our hospital partners to make sure that they are able to establish some internal communities within their hospitals, not just with Filipino nurses, but even for other internationally educated nurses who has gone through the same experience. Because by doing this, we are able to facilitate a seamless and a smoother integration for our nurses.
Right. And that is a good process that you have been doing and also an initiative that we wanted to support in with the PNH subchapters. So thank you for that. And then have you seen examples where culturally competent teaching help reduce anxiety or increase the confidence of our internationally educated nurses?
Definitely. So one of the things that we have adopted at Great Academy in the Philippines. So just as a background information, we as we started this program a few years ago, we have actually built a training facility in the Philippines that is equipped with US grade equipment and simulation laboratory. So that our goal really is for every nurses who will be going through our program, they will be used to the process of us or yeah, our process of training nurses who are stateside. So we equipped it with US-based equipment that are commonly used in the hospitals, electronic medical recording system so that they get to use Epic or Cerner. And in terms of a culturally competent teaching, what we have done is we sort of follow the models that are being used in the US in terms of simulation. So, for example, making sure that we follow the model for the Centers for Medical Simulations and ensuring psychological safety when doing simulations. Most of the time, and again, I'm always referring back to my experience when I was a learner in the Philippines. We're always scared when we hear about simulations because we know that we are being graded, and if you do not perform well, like you will have a bad rating or score, and you might fail or something like that. And and maybe partly because that's also part of your training as a student. I know that simulations is not very much used in many of the hospitals in the Philippines, which hopefully it's gonna change. Because we are trying to reach out to these hospitals so that they can maximize our the use of our facilities there. But simulation is actually like a very good opportunity, or a very good way for our nursing students and nurses alike to practice in a safe environment. That is where you should be allowed to make mistakes so that you will learn from it, and then you will be able to practice safely for your patients, right? So that's one of the things that we've tried to bring into the Philippines, that this is a simulation. It's okay to make mistakes. It's okay to learn from your mistakes. And if you have questions, then we do a debriefing sessions too, so that they can then bring up that, oh, okay, so this is what I've learned, and this is how things should be done in accordance to policies and procedures, or in accordance to international standards. And therefore, we'll try to adapt a new practice based on what is acceptable, because what I've been doing before is actually not correct. And it's okay to change process, because healthcare in general is also fast evolving. So I've seen that there has been like a massive change, especially when we talk about like debriefing after simulations, because the nurses that has gone through our program, they feel more confident in speaking up, and in a way that also helps them practice speaking up and advocating for themselves. So I think that's one of the main example that I can give in terms of a culturally competent teaching model.
Have you seen a gap between clinical practice, theory, and how do you integrate that in your program?
I would say, yeah, there's definitely a lot of gaps in theory and practice. But I think the main reason for that, though, is because in the Philippines, and again, this is my experience, we usually use American textbooks, for example, right? Then, like with American textbooks, it's teaching us something that is ideal, provided that they have because we have resources here in the US. So when we talk about documentation, we talk about properly documenting everything and putting it in your electronic medical recording systems. But the problem is you are teaching nursing students about something that is only applicable in the United States, but when they go in the clinical area, there's they don't have that opportunity to practice that. And the same goes with some of the procedures or skill sets that we are teaching our nurses, for example. If you're trying to teach them proper, let's just say proper urinary catheterization, they might not have the equipments or the consumables that we have here in the United States. And therefore, for example, and this was again like maybe more than a decade ago, instead of using like an entire packet for like for catheter insertion, they might prepare those consumables individually, which then changes the process that they've learned. So what we have done to bridge that practice gap is to make sure that while they are being trained in the Philippines, for example, a good academy, that we utilize those consumables and equipment that they will be seeing here in the US, so that while they are still in the Philippines, they have already been accustomed already. So yes, this is the process in the United States. These are what equipments or consumables that you're going to be using, and therefore we have to practice in accordance to international standards. That make sure that we do not put our patients at risk for infection. That we are assured that we follow the hospital policies or protocols, and you follow the process of documentation.
I like what I'm hearing, the simulation, which we didn't have an experience of getting it in our program back home.
Right.
I think if we can incorporate that also in the school system, hospital system, I think the transition will be so much easier. And I think that initiative of yours will be a best solution that we can do. And then also follow-up question, how can nurse educators like you recognize the signs of burnout, imposter syndrome, or isolation among our internationally educated nurses?
I think we'll just have to be very vigilant. And I think like these are some of the things that us as educators and NPD practitioners who are helping our nurses has to really focus on, because sometimes without realizing it, maybe our nurses are already trying to manifest or show some behaviors related to burnout, imposter syndrome, isolation. So we have to make sure that we try to observe and assess avoidance behaviors, because sometimes, for example, if they are missing optional practice sessions, maybe they're really trying to withdraw from the team. Hyper perfectionism, sometimes when they're overly preparing for small task, that can be a sign that they are having this imposter syndrome, because they want to look like they're perfect or like they're great nurses. Um, when they're trying to have emotional withdrawal, sometimes they become apathetic. Sometimes they try to become aloof and not participate in any activities that you are hosting, for example. And I guess like the most evident sometimes is that when they use self-diminishing language, when they talk to you and they tell you that, oh, I'm not enough, like I'm not good enough for the team, or I think like I'm dumb, or I'm not competent as a nurse. So when these things are somehow visible, for me, like that's a red flag that, oh, like I think this nurse is experiencing imposter syndrome, or is trying to feel, or is trying to isolate him or herself. And therefore we have to make sure that we listen beyond the words. We have to be very particular with behavioral cues, and make sure that we do a regular one-on-one check with our nurses, because most of the time I know that we can get so busy with work, because based on experience, like educators can get pulled into different things, and sometimes we might think that, oh, because this nurse is a preceptor in the clinical area, they might be okay. But sometimes the preceptors might also be busy with the patients too, because they're looking both after the patients and the nurses, right? So as the educators who are facilitating the integration, it's important for us to do the check-in and really ask, like, how are they doing, and are there areas that they need support in terms of their transition.
And burnout will affect also the quality of patient care that we give to our patients. So that's very important to address that one.
Definitely.
And what are some best practices that you've seen for creating a psychologically safe learning environments for our ENs?
In terms of making sure that there's psychological safety for them to learn, I would say that it's important for us to establish ground rules early. It's like leveling or setting up that expectation that there is no stupid question, that they can ask questions. It's okay to ask questions, even if they are so experienced. Again, they are in a new environment, they are new in a new setting. So we're not expecting them to be perfect. And that's the reason why we have preceptorship and orientation, because we know that they're not great in that new unit, for the reason that they might not know even the policies and procedures, right? Because sometimes, again, some people, and I've experienced this myself, like sometimes I would be scared to ask questions because if if I ask questions, they may think that I'm not good enough. So again, emphasize that it's okay to ask questions, and every question matters. It's also important for us to model cultural humility. I know like there's talks before of like cultural competencies, but I think we're moving now to the term cultural humility because according to studies, like we can never be competent with somebody else's culture if you haven't lived that. But there's this sense of being humble with cultures, like knowing that you cannot be competent with other cultures, but you can learn other people's culture and try to be accepting, be more open minded. So, um, even in our training, like even in the Philippines, like if you're from the Luzon area, if you're from the Visayas area, there's a lot of cultural nuances, and that's for the same country. So, how much more when you come to the United States, when you're living in different parts of the states, or you are working with different nationalities who are also working here as nurses. So, having that cultural humility, modeling that behavior, being more accepting and open-minded is definitely very important. Um, I would say it's also important to invite them to share their stories. I think storytelling is very important, and we can also model that behavior. Like for example, for me, I always say this to my fellow IENs when they are new, that I too struggled when I was new here, and it's okay that you struggle. It's okay to ask for help, because all of us go through that phase. Even if I have lived abroad, and I guess like that's sort of like an edge when when you have lived abroad, because then you know that um, these are some of the things that you will have to sort out on your own. But I still struggled. Like I'm not an expert of moving countries, right? And this is a different country with a different culture too from where I was after I moved out of the Philippines. So it's important for you to share your story of struggles and overcoming those struggles as well. And make sure that you celebrate small wins as well. I think like that will make a difference for them, like especially if they are new to the system and they think that they're not good enough, but then you highlight that, oh, I've seen that there is an improvement on how you perform this procedure, because like now you appear more confident when you're performing this. Or for example, in the first week, if they struggle how to access Epic or Cerner or whatever EMR they are using in their facility, and then the following week they are much better in terms of the workflow because they know how to document properly, then highlight that, like recognize and acknowledge that, so that they will feel that, oh, you know what, he's right, the educator is right, like I actually have accomplished something as compared to my old self last week. So these are some of the things that I can say will be best in creating a psychologically safe learning environment for our IENs.
Thank you, Dr. Arnold. And I can say that upon checking your Instagram, you are well traveled and you've been to a lot of like countries. How many countries have you been to? And which one is your favorite?
I've been to, I think, a total of 35 countries, and it includes, of course, the US and the Philippines too, and the UAE. Yeah.
I think Philippines and UAE are like your top two favorite. Is that correct?
Yeah, so like Philippines, UAE, and the US. Like I love. I mean, like this is the reason why like I sort of moved, because like I love, and I'm still curious to explore more of the United States. I've been here for the last 3 years, and because I'm working most of the time, I didn't have the luxury of really traveling into the 50 states. But I've been to a few states too, and I can say that each of the states have their own beauty. Yeah.
And I think more countries that you will be traveling very soon to, right?
Hopefully, yes.
And then also another follow-up question is, can you share a very powerful story of an IEN who overcame mental health challenges through supportive mentorship or educational programs?
Sure. So as I said, like a lot of the nurses that we have been welcoming into our program comes from different parts of the globe, mostly Filipinos, but some of them come from the UK or from the Middle East. And so I had this one nurse that I mentored who came from the Middle East, and she had more than 10 years of experience in the intensive care unit. But during her first week, like she really struggled here with severe anxiety and imposter syndrome because like she was not familiar with the electronic medical recording system. The equipment was a bit different. Um, and she was assigned in a med surge unit, which is a very different nurse patient ratio. So sometimes, like, when you're used to 1:1 or 1:2 in the ICU, and then you are exposed to a 1:5 to 1:7, it can be very challenging because sometimes you feel like you do not know how to organize your process, your workflow, and she was overwhelmed. Like she said, like she was overly anxious, and she felt like she did not belong to the profession anymore. So with the help of our transition program and with the help of like regular mentorship and regular check-ins and guidance on like how to navigate those workflows, for example, um, we made sure that she engages with peer mentoring circles. We've asked some of the colleagues and some of the IENs who have gone through the same experience um, to buddy up with her so that she understands that, oh, this is a normal experience for somebody who's new, and it's not just isolated to me, even if even if I'm an experienced ICU nurse. So we did some resilience coaching. We did regular debriefing with her as much as we can. Like every time that she's on shifts, we make sure that the preceptor will have some set time for them to sit down, just debrief how she is feeling. And one day, we asked her to do a reflective learning log and a reflective session, and she said that for the first time she felt like she is herself again. So for me, like that really show that when you provide those support, like those mentoring sessions, coaching and mentoring from nurses or from workmates who have gone through the same experience, it can be a powerful tool for you to help your international nurses who are struggling. And nowadays, like she is one now of our like main mentors for our new IENs in the clinical area because like she is able to articulate the challenges that she's encountered and like how she overcame it.
Great. And that's the beauty of being a nurse educator, right? You're empowering others, and then those nurses that you train are actually multiplying. So you don't need to do the double effort or triple effort, but you're actually able to reach more globally,
I
right?
agree. I think like that's where like, I think the concept of a rippling effect, right? Like you have like a drop of your experience, you pay it forward, and it creates like massive waves of support, and it's like you're paying it forward to the next generations of nurses coming in here in the United States.
Great. And it's like a snowball effect. So
Right.
really great. So what tools or resources would you recommend for nurse educators who want to integrate mental health advocacy into their teaching practice?
I think so, a few that I would say, and you can also add on, Doc Peter, because I know that you're an expert in mental health support. Um, I know that there are like mindfulness and resilience toolkits that are specifically designed for healthcare professionals. I remember that like the American Nurses Association have a well-being initiative, so that's definitely one of the resources that I would recommend. Even the Philippine Nurses Association, we actually have the Kabalikat Wellness Program. So it really helps like from an emotional perspective, like when you're stressed, when you're anxious and other emotional struggles that you have. Um, Cultural humility training, I would strongly encourage that, especially for the leaders and the preceptors who will be working with our nurses so that they understand the cultural nuances of, for example, Filipino nurses when they are now being integrated in the US healthcare system. And that's one main thing that I'd like to highlight too, because again, like when we bring in internationally educated nurses in in the United States, most of the time we always think that, oh, like these nurses should undergo cultural training because they need to understand what American culture is, and that's good. But then we also have to make sure that we actually do a cultural awareness session for our colleagues or American teammates here, because they need to know what are the cultural norms of our Filipino nurses so that they can facilitate that integration. So, for example, and we've been doing this with our partners. I usually do the cultural awareness sessions with them, with their leaders, and I always bring up, for example, that a lot of the Filipino nurses, if not all, might be a bit timid, or they might not proactively speak up. And so they know now that if they have this Filipino nurse in their unit, they will always provide an opportunity for that Filipino nurse to speak up. They will always try to make sure that they reinforce that, oh, there's no retaliation here. It's okay if you ask questions, because like we are in an, in an open environment where the culture is accepting to new ideas and stuff like that. So in a way, you're also empowering the team members that will be working with the nurses. I've also encouraged the use of regular reflective practice sessions. Most of the time, I think like many nurses and many educators sometimes overlook this side of learning. It's very important for us to do reflective learning, because that is where the nurse, him or herself, will be able to really review or like reflect in their practice and try to see on whether there are areas for them to improve. Because sometimes if you do not reflect and we are just pointing things out, they might think that, oh my god, like maybe this person hates me because like they're always pointing out things that I'm not doing well. But if they see themselves that, oh, there are actually things that I can do better, then chances are they might actually work on improving that aspect of their performance. Um, Peer mentorship, I would say, is also important. Aside from the structured preceptorship program, if you have team members there who have gone through the same experience, again, it doesn't have to be Filipino. It can be any internationally educated nurse who has experienced struggles, challenges, not just from a professional perspective, but even from a community perspective. If you can buddy them up with our new nurses, they will become a good resource for them, so that they'll be able to facilitate new learnings and integration in the system. And I think like many organizations will have these employee assistance programs. For example, like it, in the Philippines, it's not very common to have like mental health um, call or toll numbers and stuff like that. So here we need to start normalizing that it's okay to ask for help, like especially like to help support your mental well-being or mental health. We have support systems here which might not be available in the Philippines, but here it's just a one call away, and you will not be judged. There's no stigma, or there might still be stigma, but like at least here we're really very open about that, and so people should just be aware that there are resources out there that are being provided by organizations.
Thank you, Dr. Arnold. And we have the hotline number 988 in case anybody who is in mental health crisis hotline. It could be a healthcare workers or just anybody who is needing some extra help with their mental health. So please dial that number. Once again, it's 988. And then we can also do like mindfulness, which you did, meaningful engagement or meaningful connections with their colleagues. That's very important. Movement. I think that's part of the piece as healthcare providers that we're taking care of others, but we don't do like self-care. That's also important to do some movement or exercise because that could improve our neurotransmitters in our brain, which are your dopamine, serotonin, and norepinephrine. And then also your mastery. I think finding a job or a hobby or interest that you enjoy and do it more and more, that will bring further increase with your improvement of your mental health. Okay.
Definitely. Oh, those are very helpful, Doc Peter. And I'm taking notes because like I will also apply those things for my
Sure. Thank you. They call you Great Arnold or Dr. Arnold. Um, how do you see yourself 5 to 10 years from now?
Oh my gosh. So, Doc Peter, I'm a person who really plans ahead. So I have like a goal for 5 to 10 years, but like I think based on my experience over the last 3 years that I've been here in the United States, um, I would say that in the US, skies is the limit as a professional, as a nurse, for example. What I do know is that, and I'm not so sure if you're familiar with the term ikigai or life's purpose. My life's purpose is really in nursing education, whether that will be in a clinical area, whether that will be in academia, because at one point, well, over the last 3 years, I also worked as an assistant nursing professor in one of the nursing schools here, or whether that would be in corporate, because I'm technically in a corporate setting now, helping our Filipino nurses. I can just see myself to be still in that pathway of nursing education, definitely helping more nurses, not just Filipino nurses, but internationally educated nurses thrive here in the US. So I think whatever capacity that would be, as long as I'm doing what I love doing, which is nursing education, um, I'm seeing myself grow in that field of specialty in nursing. Of course, like hopefully with growth comes, like career growth and financial growth as well. But like I'm sure like for now, like I'm really sure that that is the pathway that I really would like to grow more and focus on.
Right, and I've seen how transformative your programs is, and also your passion led you to delivering an excellence in nursing education, which is really important right now, especially we don't want our patients suffering, and also the quality of care and the support that we need right now for our internationally educated nurses is there's a gap on it, so that's why you're filling in that gap, which is a solution for your pre-academy program.
Thank you.
And then I would like to go back to your Aster Global event,
Mhm.
and how was the experience? And I know you took a 12 hours flight going to that event, and you're a global nurse awardee. Can you tell us more about your experience about this?
Yeah, sure. It personally it was like an amazing experience, Doc Peter. I did not expect that I'll be selected as one of the top 10 finalists out of 100,000 applicants from 199 countries. So when it was so funny because like when they informed us that, oh, they did not even tell us that we're gonna announce the finalists. They just said that we're gonna have a meeting because we are trying to explore more on like the pending documents that you have to submit and stuff. And then I received a call at 1:30 in the morning Boston time, because I was like I think 11 a.m. in India or in the Middle East where they've hosted the call. And I was like, I haven't completed all the requirements. And then I suddenly saw people popping into the chat, into the call, and then they told us that, oh, like you're the top 10. And I was like, oh my God, like I was not ready when they informed us. But the experience was really great. I think like I've met amazing nurses from different parts of the globe. The 10 of us have very different initiatives, but the bottom line is like we really just wanted to make a difference, in the fields that we are working. I was also proud because like I was the only one selected from the United States. There were three Filipinos who represented different countries because like we are now like working abroad, and like all of us, the 10 of us, are just so passionate about everything that we do. And I think like I really enjoyed the experience, not for the glamour of it, but I think I enjoyed it because nurses were given an opportunity to highlight. I think like the Aster Guardians became a platform for nurses to be highlighted in terms of the great things that we do, because there is this traditional perception of nurses working at the bedside. And we still do, like sometimes there are still, if there are opportunities for me to work at the bedside, I still love working at the bedside. But my passion really right now really is with nursing education. So, Aster Guardians have highlighted how vast the specialties of nursing are and how nurses make an impact beyond the bedside. So even yourself now, like you are in different field of nursing and like you're making great strides to make sure that like you make an impact with a field of specialization too. So and I guess like what made the experience very special, the Peter, was it was done in Dubai, where I lived and worked for 10 years before moving to the US. It was like a full circle moment of like, Dubai was the place where I experienced a lot of professional and career growth. Because I've only worked for 3 years in the Philippines and then moved to Dubai, UAE, um, for 10 years and then now here in the United States. So to be given an award in a country where I've worked and grown so much as a nurse was just really amazing.
Thank you. And I would like to ask the question. I think a lot of people could relate to this one. And this is a question that they ask you on that Aster Global event. If you could pick three couple of things that truly matter in this journey, what will it be? Your answer is excellent at this one. So I would like to relieve, and if you will you answer the same way or will you answer differently at that time?
I would answer the same way. It will always be preparation, belonging, and empowerment. And that answer will always like stick into my mind. And again, like preparation, I've the reason why the International Transition to Practice program is born at Great Academy was because of that factor. I want nurses to be as prepared as they can be while they transition, because when I was transitioning, I didn't have that preparation and I struggled, and it was not an easy transition coming in here. So if we prepare our nurses, then we are assured that they will thrive and not just survive. And that will create a lasting impact on the patient care, right? Because then they will be more confident, they will be more competent when caring for our patients. Belonging is definitely making sure that our nurses feel like they are not just part of the medical team, but also part of the community that they are now living in. Because otherwise, then when you don't feel like you belong in a community, then I don't think you will feel that you're gonna be growing as a person and as a professional, right? I guess like that's the reason like a lot of us here in the US are thriving, because we found our community, whether that's like a local like a PNAA chapter, or maybe in your bigger circles of like, for example, for me, for myself, like I've now belonged to different organizations here outside our Filipino community. So belonging is very important, and empowerment. If you equip if you equip the nurses with the right preparation, if they feel that they belong, you equip them with the right competencies, then they can thrive. They can help other nurses become more empowered and feel more confident too, and they can provide that support and pay it forward to the next generation of nurses coming in here.
Thank you so much, Dr. Arnold, for that wonderful answer. And I would like to just emphasize your answers are really great. It's like EBP or evidence-based practice. E, empowerment, guys, fuels our growth. B, belonging sustains our spirit. And then P, preparation builds our confidence. And I think that EBP will be applied by our IENs, internationally educated nurses, and will create a positive impact to our nursing community. I know today is June 9th, and also we're celebrating men's mental health.
Wow,
I
yeah.
just saw your post in your social media. Sorry if I stalked you for the past few days. I will just like to ask permission if I could ask this important question, and you can definitely answer or not. I know the past months had been difficult for you and your family, as you have lost your brother recently, Dudong.
Right. Yeah. Dodong Julius.
Sorry
Yeah.
for that.
Thank you.
When you're used to being the one helping others, how does it feel to navigate your own grief?
It's tough, to Peter. I think if I have to be honest, and I've said this to a few friends, over the last few weeks, when that thing happened, I don't know how to feel and what to feel, because I just didn't expect that it will reach that point. And I think over the last few weeks I've been drowning myself with work. I just wanted to like to become so busy so that I will not be able to like focus on it. But I know that at one point I have to sit down and just like face, all this maybe pent up emotions. It's really like a mix of emotions right now. Um, but one thing that I've learned is that there are people in in your circle, whether it's an immediate circle or even your larger circle, who truly cares and was always gonna be there for you. There was just a lot of love pouring in during that moment, so I felt so supported, from everyone. Everyone has sent their messages, like everyone has really been great in accommodating all the things, like because like when that happened, like I could not work, of course. So like my executives have been so understanding. I had to fly into the Philippines. My team supported me in the background, while I was not here or while I was not working. Um, and even when I came back, like everyone was so understanding with the schedules and stuff. So, yeah, I think the community support and even the family member support has been tremendous and amazing. Um, and one thing that I've learned through this experience is really just one, knowing that it's okay to not be okay. You can ask for help. If there are moments that you don't know what to do, like you can just, it's okay to cry. I have those moments from time to time. And it's okay to feel different emotions too. Like I cannot say that I'm okay right now emotionally, and I cannot say that I have processed everything, because as I've said, like I've just drowned myself with work, traveling. Honestly, like I've been traveling a lot. Like my roommate here even said that, like, I don't think like you're living in the US anymore, because like, or like in Boston, because like I've just been flying whether between the Philippines and the US or like the different states. um but yeah, I think like I believe that there will always be like time for everything anyway, and as long as you know that like you're not alone and there are people that you can reach out, having that awareness will make a massive difference. And I'm really trying to like reinforce that in my mind too, that like, I'm not going through this alone. I have people that I can ask for help, and that's why like I'm very grateful. As much as like um that happened like 2 months ago, and I'm, again, as I said, like I'm still not so sure as to what to feel about it, but I know that whatever happens, I have people around me who are very supportive and who are willing to extend their help.
Great. And basically, the meaningful connections and the support is very important at this time. And I could definitely relate because during pandemic, I lost my dad, and it's a
Right.
very tough situation to be on the patient side versus being a provider or being a nurse side. So it's like a switch role. And
True.
that process grieving, as they said, grieving is a process. You can start from denial, anger, bargaining, depression, acceptance,
Right.
as Kubler-Ross, and could be non-linear, could be bouncing back and forth.
True.
With the proper support and the proper mindset, I think we can push it forward and create a good outcomes with our mental health. So how do you breathe, and also with your busy schedule when things are overwhelming to you? Dr. Arnold, what is your advice for fellow nurses that are listening to this podcast?
um I would say that number one is learn how to say no. It's so common for us, especially Filipino nurses, to just say yes all of the time. There has been a lot of commitments that I had to step back, and I have to apologize, of course, to the organizations that I've committed before. Because just because I could not handle it. Like it was just too much, especially when my brother, when what happened with my brother. So because I really wanted to spend more time now with my family, even if it's just virtually, like spending most of my weekends now with myself and with my family members. It has made a lot of difference. So that's one thing. Like make sure that you find time for yourself and your family by saying no. Um, and yeah, I always make it a point now, like because before this happened, most of my weekends are so consumed with volunteerism and volunteering with whatever causes that I believe in. I'm part of the different organizations here in the US. And yeah, now I've stepped back. I lay low for a bit and make sure that I have to, allocate more time for resting and finding the time to like meditate or reflect on things. And also, yeah, as you mentioned, like finding those meaningful connections, because as much as like, you have a lot of friends in social media and stuff, there will only be a few people who will who will be very intentional in making and in listening and having those deep conversations with you.
Thank you, Dr. Arnold. And I'm just one call away too. If you ever need help or to connect, I'm also available for you. Okay. And
Thank
if
you.
your brother is listening right now, what will you tell him? Are there any unspoken words or unspoken conversation that you would like to tell him?
I don't want to cry, but um, I guess like I just would like to say that I love him. I haven't really been there most of the time when he was growing up, because I think we were 8 years apart. So when I was in college, like he was studying in our town, and so after I graduated college, I moved out of the province too. So haven't really spent a lot of time with him. But I really do love my brother. And every time that I go home, like he's always my go-to person. So um, I think like wherever he is right now, I just want him to know that I'm gonna take care of his kids because he has two kids. Um, yeah, and I'll I'll make sure that his kids will grow with us, as a family properly taken care of, and that they're gonna thrive and enjoy this beautiful life.
Thank you for answering that. And I can relate to my brother. We're 8 years apart with my brother too.
Ah.
Yeah, so I was like have a deep connections with brothers. And also, if Liam and Kate are watching right now, what will you tell them?
I'll just I just want them to know that they're loved. Things might not make sense right now, especially with what's going on with their family. I guess that's the thing about life. Life is so complicated. Um, but I hope that they will not make this situation and this experience to think that life has been unfair. Because even if their dad left them and their mom is not there for them, um, we are there for them, and we will always love them the way they were loved by their father, um, and that we will always be their family and their go-to people.
And I can sense how family oriented you are as a Filipino. That's our core values. What would you want your fellow nurses to understand about grief, especially those who are used to staying strong for others,
Mhm.
or those who silently grieving while trying to hold it all together at work because they needed to work?
It's okay if there are moments that you'll break down. I've had those moments. But it's important to know that there are people that you can count on. Because sometimes, like, I think we have the tendency to really show this strong persona. To be honest, like when that happened, and I guess like the reason why I was not able to really process my emotions, like Peter, was because I'm the breadwinner in the family. So when that happened, when I went home, my mind was more on the logistics side. Like, what are we gonna do now? Like, how am I gonna address the expenses, all these things that I have to organize now? What about the kids? What about the legal aspects of like the custody and stuff, like just a lot of things that I wasn't even able to focus like my emotion. And there was one time like I was just so tired. I posted this in social media too. I didn't expect that that moment will happen. Like I was just lying in the room because like I was just so tired, overwhelmed. And then Liam has autism. um I didn't know, like he just went to the bed with me and then just laid down there and then like gave me a hug, and I was like, like I guess like this is Liam's way of saying that everything will be okay. Even if that was not okay at that moment, but like things will be okay. And I'm a person who really thinks a lot about the future. And I guess like you mentioned earlier that like we shouldn't be like thinking too much about the past and even overthinking about the future. There's one thing that I'm trying to learn now. So like for those who are, who are the breadwinners in their family, who are the ones who are expected to be strong, um, it's okay not to know what's gonna be ahead. Of course, like it's always good to have backup plans too, so that when things go south, like you can always have something. But like, it's really okay to not have um like fixed plans in the future because you never know what's gonna happen in the future. So be more open-minded, be more accepting, but know that you'll always have people around you who are intentional in helping you out.
Right. And a lot of positive self-talk and also being
Right.
with your core people, family,
Right.
friends, meaningful connections, and mastery is very important. Like find something that brings joy to you. And also, if we have to, if indicated, also seeking a mental health professionals will also be indicated if appropriate. Okay. And thank you, Dr. Arnold, and for your time and also for answering all our questions. I hope that all our listeners on this podcast are able to assimilate all those learnings that we have today. And if there's any final words from you, Dr. Arnold Tariga, and if you can promote also your Great Academy and your role in Insight Global for those who are listening and also our followers for this podcast. Thank you.
Sure. I think like in relation to our podcast talk earlier, what the message that I'd like to leave to those who are listening to this podcast is that behind every internationally educated nurse is a story of courage, because it's not easy to be moving across the globe, across the borders, leaving your family behind and starting over and over again. But one thing that we have to remember is that courage alone is not enough. And it's really up to us, as educators, as nurses who are now here, to help build them, to build the scaffolding that helps them not only to perform clinically but also to thrive here in the U.S. emotionally. And when we support the mental health of our international nurses, we're not really just helping individual nurses. We are strengthening the global nursing workforce. And in doing so, we honor the very heart of nursing itself, the connection, compassion, and care, which goes across the borders from the Philippines, from wherever they are, and now in the US. And in terms of what I do, I'd like to invite. I'll be visiting the Philippines next week, actually. So, if we have nurse educators, nurse leaders here from either academia or in healthcare systems in the Philippines, I'd love to partner with you, especially in terms of like high fidelity simulations. And if there's some added, if there's some value that we can add into your organization, we'd love to work with you. You're welcome to visit us at Great Academy. We are located at the SM Mega Tower, or I'd be happy to pay you a courtesy visit in your facilities next week. So don't hesitate to either reach out to Doc Peter or myself in our social media, and we can let's evaluate how we can have those synergies. Because I want to highlight, Doc Peter, by the way, that we're not just helping internationally educated nurses thrive here in the U.S. We're also trying to to give back to the Philippines through the resources that we have there right now. Because there's always this talk about brain drain in the Philippines because we're sending our nurses abroad. What we are trying to promote now is also brain gain in our Philippine healthcare setting. So if there's something that again I can add value in terms of education and training, because we have simulation laboratories there. We have US-based equipment that we would be happy to collaborate and allow our local communities to access. Feel free to approach me. And we are already in partnerships with some of the schools. University of Lausanne is one. And I'm in talks with other schools too. So partnerships and synergies, I love that because like again, I love to make sure that our nurses, even if they're gonna stay in the Philippines, are also well equipped with the right competencies to provide care for our patients back home.
Thank you, Dr. Arnold Tariga. Once again, we will post his social media account here so you can follow him, LinkedIn, Facebook, Instagram, and all his social platforms. So I'd like to thank you for your generous time for today. I know you're a busy guy. A lot of my friends told me, oh my God, how did you catch him? He's a busy guy. And I think it's all for love for nursing education and nursing excellence. And also, I think we connected during the PNA in Long Beach. I approached you and I was like, I sense that he is an educator and also doing great things which could impact and influence our profession. So thank you for what you do. I'm so proud to be Filipino and so proud to be your friend and also colleague at the PNA. So thank you so much, Dr. Arnold. Let's give him a warm of applause. And thank you for tuning in. Please make sure to listen to our next episode for our next podcast. Thank you so much and have a wonderful day, everyone. Thank you for what you do to our nursing community. Yay.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.